Welcome to Uplink. The aviation dialogue starts here. I'm Shasta Ways.
And I'm Michael Wiles.
Thank you for joining us. In recent times, the aviation industry has been facing a pivotal challenge that has often been overlooked: the state of mental health among aviation professionals. This issue has gained heightened attention due to the recent incidents, notably the case involving off-duty Alaska Airlines pilot Joseph Emerson, as detailed in a CBS News report by Alex Sunby on October 23, 2023. Emerson's attempt to shut down an aircraft engine mid-flight, leading to his arrest and subsequent arraignment on multiple charges, including endangering an aircraft, has brought to the forefront the critical mental health challenges in aviation. Following these developments, the National Transportation Safety Board, the NTSB, organized a crucial summit on December 6, 2023 to address the mental health issues prevalent in aviation. This summit, emphasized by NTSB Chair Jennifer Homedy, was focused on modernizing approaches to mental health in the industry, particularly in light of the current system for evaluating the mental fitness of aviation professionals. Amid these circumstances, Uplink Podcast sought to explore the issues further by inviting Dr. William Billy Hoffman, a distinguished neurologist and aeromedical researcher, for an in-depth discussion. Dr. Hoffman, serving as an assistant professor of aerospace at the University of North Dakota John D. Odegaard School of Aerospace Science, has dedicated his career to understanding pilot healthcare seeking behaviors and aeromedical screening. His research, which has involved studying the healthcare behaviors of over 5,000 pilots across North America, offers critical insights into the patterns and implications of healthcare avoidance in this field. He advocates for innovative solutions, such as a National Aviator Healthcare Advisory phone line, allowing pilots to seek medical advice anonymously, thereby enhancing aviation safety and ensuring better treatments for pilots. Furthermore, Dr. Hoffman's unique perspective is enriched by his personal journey. A graduate of Georgetown University of Medicine and a recreational pilot, he blends his passion for neuroscience and aerospace seamlessly. His novel, Wings of Deceit, inspired by his research, explores the consequences of healthcare avoidance among pilots, showcasing his ability to translate complex issues into accessible narratives. Dr. Hoffman's expertise is not confined to academia alone. He has been an international speaker on pilots' health, with appearances on NBC, Fox News, and his work has been featured in renowned publications such as Scientific American, Flying Magazine, and AOPA Magazine. This extensive engagement with both the media and the science community underscores his prominent role in addressing aviation mental health issues. His conversation on the Uplink podcast was particularly timely given the recent alarming incidents and the subsequent NTSB summit. Dr. Hoffman provided a comprehensive overview of the current state of mental health in aviation, delving into the implications for pilots and the public and discussing the necessary steps forward to tackling these challenges effectively. His analysis was informed by his deep understanding of the intersection between neuroscience and aerospace, as well as his commitment to enhancing the safety and well-being of those in the aviation industry. In summary, Dr. Hoffman's contributions, both as a researcher and as a public intellectual, position him as a leading voice in the ongoing conversation about mental health and safety in the aviation industry. His insights on the Uplink podcast offered invaluable perspective for understanding and addressing these critical issues. Dr. William Billy Hoffman, welcome to the Uplink podcast. How are you doing today?
Very well. Thank you so much, Shasta and Michael. This is just a really exciting
opportunity to be with you both today. And thank you so much for taking an interest in our pilot patients and this really exciting time that we find ourselves in.
Thank you for joining us. And we'll just dive into it. I'd love for you to explain to our audience so that we can better understand how the fear of disclosing mental health issues might impact the well-being of pilots in their professions.
So pilots are required to meet certain medical standards in order to maintain an active flying status. And of course, the intention of that is to ensure that pilots are safe to perform their flying duties. But if a pilot develops new symptoms and discloses it during their periodic health assessment with an aeromedical medical examiner, which is an appointed physician by the FAA, they run the risk of usually temporary loss of their ability to work or fly. And this can have negative occupational, social, and financial repercussions for the pilot. And so this paradigm can inadvertently, at times, leave pilots weighing the risks of seeking care against what it might mean for their career hobby. And, the data speaks to this. Our study of over 5,000 pilots across North America showed that over 50% reported a history of healthcare avoidance due to fear for loss of flying status.
And Billy, can you just define how you define mental health?
Well, that's a squishy, evolving, and complicated term. And it raises bigger questions about the words that we're using in society about mental health and mental wellness and how that applies to aviation. And for example, terms like anxiety or depression in 1980, 1990, in some ways can mean different things in 2023, 2024. And so we are grappling with that. But, organizations like the World Health Organization would define mental health as a state of healthful mindsets that allows people to participate in their world, seek meaning, engage with people in relationships, and find meaning in their work. But again, lots of people have different descriptions, and I think in aviation we're grappling, what does mental wellness mean exactly?
So Billy, can you explain into what sets a pilot's situation apart from other careers in terms of mental health needs? Because this discussion, it seems to be happening across other industries as well. But how is mental health for pilots different compared to other careers?
Pilots find themselves in a unique circumstance that changes in their sleeping patterns, a life on the road, and removing from social networks regularly are just unique risk factors in and of themselves. They could be factors that contribute to mental health symptoms. That's just being a human being. Those things can do that. Then add on this need to maintain a certificate, adds additional stress, all with the gravy of being responsible for the lives of hundreds of people every day and functioning in one of the most complicated systems that humans have created, and that's the aerospace system, creates this mix of stress and for many times really relies on pilots' coping skills to be well. And listen, I'm a pilot, I'm a recreational pilot. I'm sure, you guys are both pilots, I understand,
Yeah.
right?
Yeah.
Okay. And we're all very unique, we're all very special, but also in many ways, pilots are just regular human beings who need healthcare just like everyone else, and that's okay. And so I think we're finding ourselves in a period where we are rethinking about how do we help meet the unique mental health care needs of pilots while maintaining safety in the system.
So you just touched on a balance there that I think we're all trying to find within the industry. You've written about pilots avoiding healthcare due to concerns about losing their certifications. Can you discuss how we can strike a balance between ensuring aviation safety and supporting the mental health needs of pilots?
It's important to first recognize that mental health and mental wellness falls on this tremendous spectrum. And that can be, on one end, pilots facing symptoms related to regular life circumstances. This could be stress of a job, this could be financial strain, and then this can also be things like divorce or loss of a loved one. On the opposite end of that spectrum are the extremes. These would be symptoms like decompensated schizophrenia or other significant mental health disorders that result in significant disability. What's important to recognize is the conversation that our group and me personally is very interested in, and I know many others, is how do we help pilots with mild symptoms? There are many pilots who likely fall in this category, and how do we think about addressing their needs in a new way? And I think that's where our question relies, is that how do we lower the barriers to care to ensure that symptoms can hopefully resolve as quickly as possible and more effectively and dynamically identify when a pilot is okay to be flying, and maybe there's a period of time where they need to step away from flying for a short period of time, and that's just okay.
So, you've researched extensively about avoiding healthcare, pilots avoiding healthcare. If this was to continue to happen, what would be the implications for pilots and the industry and the career, apart from them being unfit to fly, and not being treated for symptoms? If they were to continue to avoid healthcare, how would this be significant for, I guess, the industry?
All stakeholders stand to gain by thinking about and working to address healthcare avoidance. For regulators, this is about safety. For airlines, this is about profitability and dependability, minimizing call out. For operations, this is about maintaining a safe and healthy workforce. And for pilots and the physicians that help take care of them, this is about ensuring that this very unique patient population, one that we all need to trust, and of course for pilots, it's for their own health. How do we address and ensure that they achieve their health in a new way? So, there's not an easy solution to this, and I think it's going to take all stakeholders coming together to think about this in a creative way. And the foundation of this is going to be trust. How do we empower pilots to help make easy and informed decisions at the point of operation about when they are and are not fit to fly, and trust going the opposite direction of how do we ensure that the regulator has the information they need to ensure that the system is safe. Ultimately, the regulator reports to the public, and their role is to say, for the general public, this system is safe and dependable, and you can fly in it with trust.
So, Billy, I'm a graduate of Embry-Riddle, and one of the things that we've learned from a few professors in our program was to protect your medical. So when you go in to see your doctor, be very brief, don't elaborate. Everything's okay. And I felt like that just put a sense of fear in myself and my peers. I'd love to hear from your point of view. Can you elaborate how this fear might be affecting pilots on a personal level and how it can ripple through the aviation industry?
If we think about the barriers that pilots face in seeking medical care and mental health care, it can feel very unique to aviation. But in many ways, this barrier is a barrier just like any other one in healthcare. Health barriers are ubiquitous in medicine. And what we're hopeful to do is frame the barriers that pilots face in seeking mental health care using the same framework and tools that we do in the rest of medicine. And that's important because that highlights that there are factors that contribute to healthcare avoidance. Part of that is the certification decision, the loss of the certificate. But it's also important to recognize that there are many factors in that system that we can modify. For example, the certification decision, does the pilot meet those minimums? Yes, no. That's probably always going to exist in some form. But there are other factors that we can address. And those factors include examples like, 1, health literacy, having the knowledge to navigate the system. 2, understanding of the policies to get to a special issuance and in clarifying and making it navigatable, so to speak. 3 is the financial burden of getting a special issuance. That's the medical testing. If you're a professional pilot that's stepping away from flying and the loss of pay, how do we address that? Things like disability insurance and many others. And there are some factors that we can address and some factors that we can't. One factor that has come up repeatedly in the data is our concerns about misinformation. And these are the conversations that are happening in the classroom. These are the conversations that are happening on the flight deck. These are the conversations happening in the chief pilot's office. And that is at times it's becoming clear in the data that there's information that is just not correct. And we all stand to gain. We all have a responsibility to spread information that's accurate. There are many pilots that don't know you can be on an SSRI and be a pilot. There are many pilots that don't know you can be talking to a therapist and still fly, in many other conditions. So, or many other circumstances. So, we need to work on the misinformation part. And ultimately, the regulator doesn't own that. We own that.
Yeah.
That's interesting. So you suggested, and you've written this, I believe, in one of your studies. You suggested that doubling down on an imperfect system is not the right answer. Can you propose alternative approaches or solutions that could help address the mental health concerns of pilots in a more effective and compassionate way? What are some practical things that could be put into place?
It should be noted that the consistency and the safety of the system is dependent on people being honest. So it's important that you should, as the rules stand, you should disclose your health information. And pilots who intentionally break that rule, as made evidence by this Washington Post article with the VA disability claim, that makes an example of the challenges that lie ahead. And ultimately, to some degree, there's questions about pilots should probably be held accountable for that. But more broadly, from a policy perspective, doubling down and punishing pilots is not going to bring about the change we want to see, most likely. And this goes back into the hospital. For example, if there is a near miss or a mistake in a hospital, blaming that healthcare provider will maybe to some degree address that specific instance. But just like pilots, the far majority of healthcare providers don't want to make a mistake. It's not intentional. And so targeting and blaming individual members of the system may not bring about the change we want to see. So it compels us to think hard about how we do better and how might we do this in a new way. And one possible way that, to my knowledge, is not operationally ready yet, it's a research question, is how might we transition from our clinical approach in mental health and aviation, that's using diagnoses and the use of healthcare services as a marker for risk, and transition to more of a performance-based approach. That is, regardless of what's in the medical record, can the pilot perform their duties at the point of operation? How might that be achieved? That would be using biometric data and point of operation neuropsychological testing that the pilot can use in the airplane, can help basically objectively quantify their I'm safe checklist. And what that might look like if I have a magical wand. See, I'm an academic, so I can have pie in the sky and think about what could be someday in the future, even though it doesn't exist yet. But that would be a pilot gets in the airplane, pulls out their device and says, this is my sleep pattern. These are my this is my fitness data. And they do a quick sample of neuropsych testing. It says, this is how I usually test. I'm good to go. Or maybe it says, this is a little less than I usually am. Should I be flying today? Do I need to talk to a therapist? Do I need to talk to somebody? Do I need to sleep? Or maybe I simply need to tell my co-pilot, I'm not batting 100 today. Keep an eye on me. And that's how we address this risk in a new way.
I think that's fascinating. Just a sidestep, because you said it might be far-fetched, but I think this is what we see in sports players. Basketball has become known for being an analytical sport where they're measuring your steps, you're measuring how hard your footprint is, they're measuring your vertical, and before you are good to go, the health department is speaking with the coaches to let them know sort of your status. And so I believe there's a parallel there between athletes who are performing at a high level and pilots. And so maybe it is a step that needs to happen, as you're saying, going from analytical or clinical to more performance-based.
And you're absolutely right. There's nothing novel here. There's nothing truly, that we're not seeing in other industries. And that goes back to, aviation is unique, but we should be looking to other disciplines who have addressed these similar patterns in different ways. In medicine, there are studies out there using emergency medicine residents using these types of tools that helps determine or quantify fatigue on a night shift. And so these things exist, and we can be leaning into them to help answer these questions. But an important point is that, to my knowledge, I don't think people are advocating for pilots with severe mental health symptoms to be flying. I think all would agree that we need to have a system that allows for the identification, the quick, allow of treatment for this group. And then if they choose to, and if they're fit to, go back to flying. But what we're really interested in here is people with mild symptoms, somebody facing a divorce, stress, changes with the child, or just life stress. How do we help that population get the care they need easily?
Billy, I'd love to hear, within your research, have you at all looked into new moms who take a break from flying to go have their kid and them coming back in? I don't know if you've done any research in terms of where their mental health is and if there are any resources for them.
You bring up a tremendously important point. Pilots are not a monolith. It's highly heterogeneous, and it's becoming increasingly so, and that's exactly what should be happening. We're going to be having more voices and more perspective in the pilot population, and that is so exciting. But for that reason, we know that subpopulations are going to be facing unique barriers that other populations will not. And we published a paper showing that female pilots have higher rates of healthcare avoidance than non-female pilots. And the hypothesis is that people from traditionally underrepresented groups in the pilot population may face similar challenges. So at various levels, ranging from the one-on-one relationship in the cockpit to the chief pilot's office to flight schools to a policy level, how do we build that into the system to meet those unique needs? There are many unanswered questions. Postpartum depression is a question. The unique factors like for parenting that both female and male pilots face. How do we address this in a new way, and most importantly in a very dynamic way that minimizes loss of flight time if it's necessary, and when ready to hopefully get pilots back on the flight deck if they want to, and as quickly and safely as possible.
How do you think informal healthcare impacts the overall health management of pilots? If pilots started to open sort of this new pathway, how would it impact the overall health management? I know you talked about the biometrics, but are there any other impacts that you think would come into play?
Finding oneself in a pilot lounge or in another social setting, sometimes pilots might hear about people seeking informal medical advice, seeking informal treatment, and relying on resources like the internet, or simply just foregoing care altogether. The chair of the NTSB, Jennifer Hamady, spoke about this at the NTSB roundtable on Wednesday, and that is that a system where pilots feel, and I'm paraphrasing here, so I'm doing my best to paraphrase it as accurately as possible, but that is that pilots in a system that feel that they are compelled to seek care informally or withhold information result in a decrement in safety. And so while the time is now to rethink about a system where we lower the barriers to care, that is it possible, and how can we build a data-backed way that seeking care is not a marker, may not be a marker for risk most of the time. It's a marker for safety because it's addressing latent risk in the system. The data suggests there is a potentially large population of pilots who are suffering in silence, and in using standard SMS kind of terminologies, that would be called a latent risk. The safe pilot is not one that is in the system getting special solutions, getting care. The unsafe pilot is the one that's suffering in silence quietly. And another speaker at the NTSB roundtable spoke about this. That is that the silently suffering and untreated pilot is probably the least safe. The pilot that is seeking informal care but not disclosing it might be a little safer. And the pilot who is getting the formal care that they need and just going through the process may be the safest. These are hypotheses. I don't really have the data to back it up, but this is just using logic and pragmatism. And but using the chair's words, not mine, is that pulling the pilot seeking formal care for multiple months and that perceived punishment may not be the system we want to have for the future as younger generations come in. This is my own opinion, is that as language around mental health changes, there's going to be less and less tolerance for these barriers for seeking talk therapy. Anecdotally, I talk to young people who are just like, oh, well, if I can't see a therapist, I'm just not going to fly, which culturally is very different than maybe the 80s, 90s, and generations before. So aviation, the face of aviation, the culture of aviation is changing rapidly. And so it'll be interesting to see how we grapple with that in new ways.
It seems like we are going through a phase shift, as you said, and a big part of it is that there are these systemic structures that exist in the industry today that don't fit the demographic. And so it's really interesting because changing the fabric of the industry requires really removing some of these systems that have been in place for a long time. And because as you're saying, there's more people who are silently suffering than we assume. And so there has to be sort of like this grappling with, wow, well, actually a big part of the population isn't well. And so we need to sort of create some, a safe space for them to express themselves.
Certainly. And it raises bigger questions. Who owns mental wellness in aviation? The airlines are a business and will often use financial metrics to measure success. And of course, there's a range and there are many good Samaritans, but ultimately they're a business. The FAA and regulators are safety organizations. Oftentimes they use safety metrics to measure success. Well, aviation is exceptionally safe. But the voice that's lost, in my opinion, is often the voice of the pilot patient. And so how do we amplify that voice? How do we bring in that voice? And I'm just so inspired by this rising generation of pilots coming in because they're so full of energy and creative ideas and ready just to like engage this in a new novel way. And the hierarchical culture that often finds itself in aviation just doesn't exist in the same way for many of these young people, which is so great. And that's how innovation is generated. So it's important that people get into the conversation and help make that contribution to progress forward. And I'll also mention that in the rest of medicine, this is a simple boiled down model, but how do we bring drugs to the market? There are three powerful voices as we bring drugs to the market outside of aviation. One, there's the voice of the drug company that makes the medication. There's two, the voice of the regulator, that's the FDA, that ensures safety. And three, there's the voice of the pilot patient or the patients advocating for the medication. And so those three voices come together to bring about safe, effective, and financially solvent drugs. Well, if you use that corollary in aviation, you can use a similar model. One, there's the airlines, that's the company. Two, there's the regulator, that's the FAA. And three, the point that's missing here seems to be the voice of the pilot patient. That loud voice of the patient's demanding care is lost in some ways. And that's not always true, but how do we build that in? My personal recommendation, I don't speak on behalf of anybody else today, but myself, is that leaning into organizations like the Aerospace Medical Association and other grassroots organizations to help organize that voice in a productive way to help to help bring that to the conversation with how we grapple with these challenging questions.
In terms of the voice of the pilot, in this case, the airline industry is one that is heavily unionized. In this case, would it be the pilot unions that need to speak up on behalf of the pilots?
Pilot unions have done so many incredible things and continue to do so many incredible things for pilots. And their voice is so important and to ensure that pilots get the care that they need. But, there might be opportunities for this voice to be organized in either different ways or additive ways. And that might be, through organizations like medical associations or other grassroots efforts because of the dynamics in the system. The system exists currently with certain players, but we see that there's a problem. So this gap that brings us together is a problem in some degree. So we may need to think about how we address that in a new way, and bringing in additional voices will be a big part of that.
So, Billy, a lot of our discussions have been focused around the U.S., and I've had the privilege of living in the Middle East for about 4 years, and I had the opportunity to just make so many pilot friends over there. And I quickly learned that the mental health spaces and the culture is just so different outside of the US. So I'd love to hear from your observations or research. Is the international aviation community shifting their culture around mental health now that there are more discussions happening in the US?
It's an incredibly important question. And what I will say is, from a data perspective, there is a huge opportunity to help answer that question in a data-backed way. The long answer is I don't know. And going back to encouraging our young rising researchers and aviators to help us answer that question with data. I've had the privilege of learning from some incredible people at ICAO, which I'm not speaking on behalf of in any way, but thinking about these questions from a global level is very challenging because of local cultural differences, jurisdiction and rules differences, resourcing differences. When we zoom out and look beyond the US, I think you're right that the challenge seems to exist, and there is even a bigger data gap that we need to try to fill.
So you've talked about mental health avoidance among airline pilots, but you've also researched mental health avoidance among military pilots. You have a study that says 72% of military pilots report in healthcare avoidance behavior. Could you explain what prompted you to investigate this issue in the first place?
Certainly. So importantly, I speak on behalf of nobody today, and these views are my own and not necessarily those of any other organization. And everything I will share with you has been published already. And that is that of all comers, we found that just about 50% of U.S. pilots reported history of healthcare avoidance. Well, the number one cited factor that people will say discourage people from seeking care in the U.S. seems to be financial. That is, that if they step away from flying, they're going to need to pay money to get their certificate back, and they might lose income. But interestingly, if financial loss was the only factor that resulted in healthcare avoidance, theoretically there should be no healthcare avoidance in the military because pilots are salaried. But healthcare avoidance is not only similar than the general population in the military, but it's actually higher in the military than it is in the rest of the population. So this raises a couple of points. That one, the aeromedical system of the civilian sector is very different from that of the military. And what that tells us is that we need to be studying these populations in different ways because they have unique factors that influence care. And two is that there's an opportunity for knowledge sharing. There's things that the airlines are doing very well that might be served in other jurisdictions and vice versa. And so it's a highly heterogeneous population, and this data speaks to that.
So kind of taking it back to, I think changing culture, you kind of have to go back to the foundation. So I'd love to hear your opinion. Based on your findings, how might pilot training or educational programs be adaptive to addressing these healthcare avoidance tendencies?
How did we get here? How did we get to this problem where healthcare avoidance is so significant? And to answer that question, it can be helpful to look at it from a historical perspective. In World War I, if you were not healthy enough to lead soldiers on the ground, you were put in an airplane. Well, after losing a bunch of airplanes because of fitness problems, they quickly realized that they needed some medical standards. And so they generated those standards. And in order to determine whether or not pilots met those standards, they made a special discipline in medicine called aerospace medicine. So this came out of that period of time. And of course, there's people long before them researching the Montgolfier brothers and studying hypoxemia. But and these physicians in the military during this time of conflict had two jobs. One, does the pilot meet the minimum standards? Yes, no. And their second job was, if the answer is no, they had a responsibility to get them to yes. So they had a regulatory relationship and they had a therapeutic relationship. And that seems to exist in many military organizations today. Flight surgeons have a regulatory relationship and a therapeutic relationship. Well, zoom past the war, and now we have a bunch of civilians that go into the general population, and now we need to maintain medical standards. How do we do that? In today's current AME model, we borrowed from that system. except an AME only has one job. Does the pilot meet the minimums? Yes, no. But if the answer is no, it does not fall on the AME to get them to yes. The AME only has one job, regulatory. So military flight surgeons have two jobs, regulatory and therapeutic. AMEs have one job, for better or worse. It's regulatory. I'm not saying it's good or bad. That's just the system we find ourselves in. Well, how do we get to yes? In the United States, it really ends up falling on the pilot. And for that reason, navigating the system to get a special issuance requires a tremendous amount of health literacy. There are many physicians that don't know the difference between a neurologist, a psychiatrist, a neuropsychologist, and a neuropsychiatrist. And many of these specialties are the ones that pilots will need to get reports from in order to get to a special issuance. So it requires a great degree of health literacy. So flight training programs are in a unique position to help trainees build the health literacy to have the tools to seek a special issuance someday in the future. Most people are going to have a medical thing. That's just being a human being. And so having the tools to navigate a system it will really serve them well. So that's point one. Two is normalizing care seeking and spreading accurate information.
Are there other negative repercussions other than loss of pay that pilots face when they're grounded due to mental health issues?
Well, I'm speaking to the choir here and probably many of your listeners, and that is that anecdotally, for many pilots, being a pilot is a part of their identity. Dr. Susan Northrup, who I have a tremendous respect for, and I find her to be a great leader in this charge. She's been, I think we have a lot to thank her for. And she talks about it. She talked about this at a conference in Cologne earlier this month. And she says, if she is asked, what's the one word that summarizes her or that her identity, she used the word mom. When she asks pilots, and I'm paraphrasing here, doing my best to accurately portray what she said, and she said, many pilots will use the word pilot. And I think that's true. My experience has been that to be the case. And you guys are laughing, I see, and maybe you find that to be accurate too. And so beyond the financial loss, beyond the headache of navigating a special issuance, is that we're asking this population in many ways to what they may perceive as foregoing their identity. There is some deep cultural factors with this here too. Also, the type of person that's willing to sit in front of 250 passengers at 38,000 feet over the North Atlantic and be ready for an engine failure, an electronic failure, a medical emergency, and a bad weather storm and say, you know what, I got this, may not be the same types of skill set as somebody who's easily ready to raise their hand and say, you know what, I need to step back and get help. And so I think that is definitely uniquely aviation, and that is how we need to rely on our young people, our experts, and how do we build a system that addresses these healthcare needs that are very human in a very aviation way.
So Billy, we talked so much today about statistics, studies. If someone's listening to this episode today that is struggling with mental health and they're in aviation, have you found a resource or a pathway that they can pursue where they won't find misinformation, that the information might be a little bit clear to understand? Have you found an avenue, a resource where people can go to just have a sense of relief or just to learn more of what their options are?
If a pilot, so I feel a responsibility to say a pilot who is finding themselves needing help should absolutely get help soon. And that's for a couple of reasons. One, by getting help early, hopefully the symptoms will resolve quicker. And that's also just good for your general health and also will be helpful in your overall trajectory. Two, by seeking help early and disclosing that information early, it builds trust in your certification examination. And a pilot with mild symptoms who seeks, certain mild symptoms like talk therapy or even just a simple SSRI oftentimes finds themselves in a situation that's easier to certify than a pilot that's had hospitalization or alcohol misuse or something like that. So if you're a pilot needing help, get help. You need it, and that's okay. You're a human being, and disclose that information. Be truthful on your certification exam, and And that will be good for both your health, and it will lower the risk of, and it'll ease in certification. And empower yourself with knowledge. The FAA Aeromedical Examiner Guide, FAA AME Guide, if you just Google it, it's a PDF on the FAA's website. And if you go Control F and search your condition, you will actually find it's actually a very user-friendly document. And it's very checklist oriented for pilots. And so go and read about what you need to get your certificate back. Or, in assuming that you're ready and that's what you choose to do. But that document is very helpful. And if you find that you have questions, print that document off. And when you see your healthcare provider, have that resource with you, and they can help you navigate that information that's needed, or of course, with your AME. One thing that we see often is that, with a pilot with a mental health diagnosis, for example, is it's really best just to get the care that you need and get better, and wait to submit your certificate application until you're better. Because for better or worse, there can be back and forth between the pilot and the FAA if you're not quite ready yet and they need observation periods. So I would encourage pilots to work with their AME to decide strategically when it's time to submit a special issuance application, because these are ways to kind of forego the administrative hiccups, and that can be either submitting too early or not including a checklist.
How is this recent Alaska Airlines incident moving the discussion along? Obviously, there has been a lot of public commentary, and this case is ongoing. But how is it moving the discussion along?
I can't speak to what did or didn't happen during that unfortunate event, other than I can say my heart goes out to the many, many people impacted by this difficult situation. And we feel stories like this speak to the broader issues that we face related to healthcare avoidance in this pilot population. These events speak to the data that we see, and also what we see in clinic. And so we have an opportunity to bring the stakeholders together and think about how do we do this in a new way. And I hope that we will lean into the general interest there is in this topic to make meaningful project forward. I'm really of the opinion that everyone is wanting the same thing. The regulator, the airlines, the pilots, we all want the same thing. And that is that pilots to get the care that they need, and we maintain safety in the system. We have a chance to work together to make that happen, and we need all stakeholders at the table.
So, Billy, as we wrap up this discussion, you've been on so many panels, discussions, publications. You've written a book about this topic. I'd love to hear from you. What is a low-hanging fruit that the industry can do to kind of help move the needle in a positive way with mental health? And what would you say is a high-profile one that the industry can invest in to get this, to get people talking more about mental health and just feeling safer in this industry?
I love that question. That's terrific. And that is a couple of things. We should be leaning into the data that exists to help answer these questions. And I would recommend that we address this in a health systems approach. And what I mean by that is that there are factors in the system, there are many factors that support utilization and factors that discourage utilization. One of those factors, and that seems to be the loss of certificate. That's part of the story, but there's a lot to the story. And so what are the factors that are low-hanging fruit? This is an important question. What are the minimum resources an airline pilot in the United States should have access to as it relates to mental health? If you fly for a mainline U.S. air carrier, you may have access to different peer support services, disability insurance, in-house aeromedical expertise to help navigate a special issuance process than if you fly for a small carrier, you fly for a small business airline with 2 pilots and 1 airplane, or if you're in training. So because there is this variation, one can make the argument that this is inequitable, that we need to be thinking about what are the minimum resources people have. And that's important because we're going to need to bring different people to the table and be likely looking beyond aviation. For example, the CDC is responsible for public health. Like OSHA and organizations like that are responsible for workplace safety. Insurers are responsible for insurance plans. So we need to look beyond aviation and bring those relevant people to the table. So low-hanging fruit are the financial factors, disability, EAP programs, peer support services, that stuff and misinformation, that's stuff we can change today. Longer term, I would encourage us to think about how do we transition from a clinical approach to mental health and aviation to more of a performance-based screening approach. And we are just about to publish a paper in the Journal of Occupational Environmental Medicine proposing how this might be achieved. But again, to my knowledge, there's no data that's ready that says that there's like an operationally ready tool to do that, but there's a chance for us to come together to research this. And the last plug I'll say is the Aerospace Medical Association is just about to publish a consensus document of research priorities related to mental health and aviation. This was an effort that I had the privilege of leading where we brought 50 aerospace medicine experts from across 7 ICAO countries over the course of 3 months that we generated this consensus statement. I hope all your young researchers and aviation lovers out there who need to do undergraduate thesis or graduate thesis, look to that document to pick the questions that we can all be marching in the same direction.
Well, Billy, thank you so much. You've been a wealth of knowledge. I think we're still at the surface of the conversation. There's so many places that we could have taken it, from the military to the civilian side, in addition to just there's resources that are on the market, as well as you talked about, the low-hanging and high-hanging fruits. But you've given us and our listeners a lot to think about. And thank you for your advocacy and your research that has helped drive in this process. And we look forward to, continuing the discussions with you and the rest of the industry.
It's been my tremendous privilege, and I'm really grateful to you both for really, digging in to get into this complex challenge. So thanks again.
Thank you so much for joining us this week. Before we move on, we've got just a couple of important housekeeping notes for all of our listeners out there. The first is join Uplink LinkUp community. Here's one benefit of joining. If you're looking to dive deeper into the world of aviation and join the conversation, we'd love for you to be a part of our Uplink LinkUp community. It's a great space where enthusiasts like you can discuss, debate, and share insights about everything aviation. Joining is super easy. Just head over to our website or check out the show notes for the link in our Uplink LinkUp WhatsApp group. We have a general group for aviation discussions, and we have a special Uplink LinkUp DC Metro group for our listeners in the DC area. Being part of Uplink LinkUp means you get to interact directly with us and other aviation enthusiasts. It's a fantastic way to get your questions answered, share your opinions, and even influence future podcast topics. So don't miss out on being part of the Uplink LinkUp community. Join today and take your love for aviation to new heights. We can't wait to interact with you all.
Have a good week, Shasta.
Thanks, Michael. Have a great week.